Quadratus lumborum block. Indications: analgesia for procedures in the lower abdomen and pelvis, analgesia for post-cesarean section, analgesia after hip surgery, chronic pain management for chronic abdominal wall pain, post-iliac crest harvesting, pelvic pain. Relevant anatomy. The quadratus lumborum muscle originates from the iliac crest and inserts at the 12th rib and transverse processes of L1 to 4. The ventral rami of the spinal nerve roots run between the quadratus lumborum muscle and the psoas muscle. The quadratus lumborum is surrounded by the thoracolumbar fascia. The thoracolumbar fascia is made up of 3 layers: anterior, middle, and posterior. The anterior TLF is anterior to the QL muscle. It blends with the psoas major muscle fascia medially and laterally continues as a transversalis fascia. Relevant anatomy. The transversalis fascia covers the inner layer of the transversus abdominis muscle. The middle TLF is between the erector spinae and the QL muscle. It is posterior to the QL muscle. The posterior TLF is posterior to the erector spinae muscles. The posterior and middle TLF fuse to form a lateral raft that joins medially to the internal oblique and transversus abdominis. Positioning: prone or lateral decubitus with block side up. Local anesthetic and volume: 20 milliliters of local anesthetic per side. For surgical anesthesia or for the management of chronic pain, a long-acting agent like ropivacaine or bupivacaine would be indicated. Ultrasound technique: a curvilinear, low-frequency transducer is required, facilitating tissue penetration of ultrasound and a wide field of view. The transducer is placed in transverse orientation at the posterior or mid-axillary line at the L4 level. Following the tapering anterior abdominal muscles, the transversus aponeurosis is identified and quadratus lumborum is noted medially. The quadratus lumborum muscle is identified deep to the latissimus dorsi and paraspinal muscles. The psoas major muscle is located deeper to the quadratus lumborum. Identify the tapering abdominal muscles EOM, IOM, and TAM. Identify the quadratus lumborum and psoas muscle on a deeper plane. Depending on practitioner preference, the following blocks may be performed. Type 1 block or lateral. The needle placed at the point where the quadratus lumborum muscle and anterior abdominal muscles meet. This is located at the anterolateral edge of the quadratus lumborum muscle. Local anesthetic is deposited superficial to anterior TLF and transversalis fascia. Type 2 block or posterior. The needle placed at the posterior border of the quadratus lumborum between the erector spinae and latissimus dorsi. Local is deposited outside the middle TLF. Type 3 block or anterior, aka transmuscular or tequila. The needle placed through erector spinae muscles to the space between the quadratus lumborum muscle and the psoas major muscles. This type has been described being done in a sitting position as well. Needle described as entering on medial side of probe and advanced laterally. The needle is superficial to the anterior TLF. Complications and side effects: intravascular injection, dural puncture, epidural spread, hypotension, hematoma, organ puncture. For further information, please see suggested reading.